Throughout a normal day, we take in foods and beverages containing differing quantities of water and solutes. We also lose fluids through sweating when we are active and by urination. Our kidneys maintain control of our plasma concentration of these substances in order for our cells to function efficiently. The movement of solutes and water in the kidney's functional unit, the nephron, dramatically alters the concentrations of substances in the plasma by a process known as countercurrent multiplication. The kidneys are located just above the waist in the posterior abdomen. There is an indentation on the medial side where the renal artery enters and renal vein and ureter exit. As blood enters through the renal artery, the kidneys regulate the amount of dissolved substances in the plasma and excrete the excess or wastes into the ureter as urine. The amount of substances in blood affects the tendency of water to remain in the blood supply. In order to maintain a constant bloodstream osmotic pressure, the kidneys regulate water as well. If the plasma becomes too dilute, for example, the kidneys excrete excess water into the urine. Blood from the renal artery enters the kidney where it branches through the medulla of the kidney to the cortex. In the cortex, the smallest arteries become arterioles, leading to ball-like capillaries known as glomeruli. Blood leaving the glomerular capillaries flows through peritubular capillaries wrapped around the tubular nephron before draining into renal veins. At the glomerular capillaries, plasma-like fluid filters out of the bloodstream into the nephron tubule, where substances are either reabsorbed into the peritubular capillaries or continue on toward the collecting duct to be excreted as urine. To explain the physiology of the countercurrent multiplier, we will begin with the ascending limb of the nephron loop. It is important to note that the entire ascending limb is impermeable to water, but actively transports sodium, potassium, and chloride ions out of the tubule and into the interstitial space. As active transport of ions out of the ascending limb continues, the interstitial fluid surrounding the tubule becomes more concentrated. As a result, a vertical osmotic gradient is established in the interstitial fluid due to the high concentration of ions deep in the medulla and gradually decreases toward the cortex to levels consistent with fluids in the rest of the body. The osmotic gradient in the interstitial fluid is measured in units of osmolarity, with larger numbers representing higher concentrations of solutes. On the other hand, the descending limb of the nephron loop is freely permeable to water, but impermeable to most other substances. As filtrate passes through the descending limb, water is drawn into the interstitial space via the osmotic gradient developed by the ascending limb. By the time the tubular fluid reaches the bottom of the nephron loop, housed deep within the medulla, it is at its maximum concentration, and the interstitial fluid is at maximum osmotic pressure of about 1200 milliosmoles. Recall that the ascending limb of the nephron loop is impermeable to water, but actively transports sodium, potassium, and chloride ions into the interstitial fluid. As a result, the tubular fluid becomes less and less concentrated as the filtrate ascends back toward the cortex. The filtrate becomes even less concentrated than plasma as it reaches the distal end of the nephron loop. The net difference in tubular fluid concentration between the descending and ascending sides of the countercurrent mechanism results in a 200 milliosmole horizontal gradient. Overall, the filtrate becomes progressively more concentrated as it passes down the descending portion of the loop and progressively less concentrated as it moves up the ascending loop. The countercurrent multiplier is responsible for creating and maintaining a vertical osmotic gradient within the kidney tissue. Its purpose is to provide a mechanism by which the reabsorption of additional water can be implemented. If, however, antidiuretic hormone, ADH, is present, water channels are formed in the distal convoluted tubule and collecting duct to allow water to be reabsorbed from the tubular fluid. The reabsorption of water from the collecting duct is the result of the vertical osmotic gradient established and maintained by the countercurrent multiplier. Retaining additional water results in a decrease in plasma osmolarity, bringing blood volume concentrations back to normal. The countercurrent multiplier runs continuously to maintain the vertical osmotic gradient in the renal medulla so that hormonal control of water excretion and consequent plasma osmolarity can be kept within very tight parameters. Even slight changes in the blood osmolarity can affect the size of our cells and their ability to function normally.